Before a spinal cord injury, you were able to move freely and change positions when you were uncomfortable. Having a spinal cord injury or a brain injury can decrease a person's ability to feel and move. They may not know when a position change is needed to prevent the development of a pressure injury. Now, you will have to think about protecting your skin. A pressure injury is the most common secondary complication of a spinal cord injury. Pressure injuries, skin sores, bed sores, and pressure wounds are all words meaning the same thing. They are used when talking about an area of damaged skin that is caused by constant pressure, which causes skin layers to break down. Other factors that increase the risk of a pressure injury include friction or shearing and moisture from sweating or incontinence. These injuries usually occur over bony prominences, like your ankle, heel, or tailbone. These are places in the body where the bones are closer to the surface and do not have much natural padding or protection. Medical devices and personal items may also cause a pressure injury. Pressure injuries are classified as stages 1 through 4, based on the amount of tissue that has been damaged and how severe that damage is. All healthcare providers use these stages to describe pressure injuries, so it is important to be familiar with these terms. Stage 1. This stage is the most important to identify because it is the beginning of a pressure injury and damage may be reversed. However, if it's ignored, this injury could become more severe. A Stage 1 pressure injury is an area of skin that has had pressure on it, causing the skin to change color, pink or red in light skin, red, blue, or purple in darker skin. Frequent skin checks will help you to recognize what normal skin is for you and ensure that pressure injuries are caught early. When any red, pink, or discolored area of the skin is noticed, you should check to see if circulation is present by gently pressing on the area. If the discolored area turns lighter than your normal skin tone before returning to the discoloration, there is still circulation to the area. This process is called blanching. If the discolored area does not blanch, it means circulation has been damaged. In both cases, pressure must be relieved to prevent further damage. Once the skin returns to its normal color, you may return to your usual activity again. Stage 2 pressure injuries are a shallow, open wound with a red or pink color that is either shiny or dry. It may also present as an intact or broken blister. If you discover a pressure injury that is now an open wound, you must have it assessed by your medical team. You and your doctor will design a plan for your healing, but until then, you'll need to stay off the area completely. Stage 3. A Stage 3 pressure injury is considered severe, with the damage extending through all layers of the skin. This wound looks like a deep crater, sometimes with damage to surrounding areas. Fatty tissue may be visible, but bone, tendon, or muscles are not exposed. The wound may include undermining and tunneling, which could include deep craters under the skin that may not be seen on the surface. The depth of a Stage 3 pressure injury varies by where it is on the body. The bridge of the nose, ear, back of the head, and heel do not have thick tissue, and a Stage 3 can be shallow. In contrast, areas with fatty tissue, like your bottom, can develop deep Stage 3 pressure injuries. Healing of a Stage 3 pressure injury may take many weeks or months and will require collaboration with your medical team. The person with a Stage 3 wound may be required to stay off the area, meaning bed rest or immobilization until the skin is healed. Stage 4. This is the most severe and serious stage of skin breakdown with the deepest levels of damage. In Stage 4, the pressure injury extends all the way from the surface of the skin through the muscle to the bone. Dead tissue or drainage may be present on some parts of the wound bed and may include undermining and tunneling. Because stage 4 sores can extend into the muscle and supporting structures like bones, joints, and tendons, a person is at high risk for developing a bone infection called osteomyelitis. Additionally, surgery is often required to assist in the closing and healing of the stage 4 pressure injury. If surgery is needed, complete bed rest and immobilization will be required for approximately 5 weeks. Occasionally, a wound is classified as unstageable because you cannot see the wound due to a covering of dead tissue or wound debris. Until the base of the wound is revealed, with help from your medical team, the true depth and stage cannot be determined. A deep tissue injury is an area where the skin does not blanch and has a deep red, maroon, or purple discoloration. Skin may be open, surrounded by skin that is a non-blanching deep red, maroon, purple discoloration, or a blood-filled blister. This type of injury is caused by intense and/or prolonged pressure and shearing forces. The wound may change quickly to reveal how much damage there is inside, or it can heal without ever opening. This depends on how the injury is being taken care of. The area of a healed pressure injury will develop a scar, and scar tissue is never quite as strong. This fragile area is at an increased risk for getting another wound. It's important for you and your caregivers to understand the seriousness and the severity of pressure injuries. Take proper care to ensure that your skin stays healthy. In the next video, you will learn how to care for your skin.